Good morning. My name is Marion Juliet. Can you say your name for the record, please?
Good morning, Marion. My name is Elaine Castle.
And what is your candidate number, please?
My candidate number is 221143050.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
How do you handle a busy shift, or heavy workload?
Busy shifts are a regular part of my work as a nurse. I used to get overwhelmed when I had more to do than usual, but as I've gotten more experience, it's become easier to deal with. Taking a moment to meditate or do my favorite breathing exercise helps alleviate immediate stress. I've also been working on getting more comfortable asking for help or delegating when I need it. I've worked alongside really wonderful people who are usually willing to lend a helping hand, and who I'm happy to do the same for when they're having a busy day.
Tell me about a time you had to resolve a conflict with another healthcare worker.
At my previous job, I worked with another nurse who approached patient care differently than I did. It was hard to care for the same patients, because we had different mindsets. She tried to be as quick as possible, while I tended to take more time with patients. I used to get frustrated because it didn't seem like she put as much effort into care as I did, until I sat down and talked to her about it. I actually ended up learning useful tips about time management and efficiency from her, which helped me understand her mindset and improve my ability to care for patients.
How would you handle a crisis or emergency situation?
In my work as a nurse, I'm fortunate in that I haven't seen many patient emergencies. When I have dealt with these situations, I always take a few deep breaths or count to 10 to calm myself down, then focus on the patient or person who needs my help. Because I am not the most experienced with emergency situations, I would also ask for help or support from another nurse, doctor, or staff member who has dealt with more patient emergencies.
Describe a time you had to work with a difficult patient.
Most of my patients are kind and grateful to have my help, but in my first job as an RN, I had an especially rude patient. It was difficult to be around him since he had a problem with seemingly everything my coworkers and I did. I complained about it to a coworker, and she helped me understand that I could be more sympathetic to him. Obviously, we work with people who are ill or injured every day, but being sick and hurt is a unique experience for most patients. I continually remind myself that my patients are probably feeling far worse than I am when they're upset. That way, I can focus more on caring for them to help resolve their pain and fear.
Do you work well with doctors, other nurses, and staff members?
I greatly enjoy working with other staff members. Working and communicating with other staff members is crucial to providing proper patient care. At my last position, I was supposed to give a patient another dose of his medication. However, I didn't realize that his doctor had changed the dosage until I happened to run into her before heading into the patient's room. She had made notes of it on his chart, but talking to her about the change helped me understand more about why she shifted the dosage and how I could give better care to the patient.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning, Marion. I'm Elaine, one of the nurses in charge today.
Hi, good morning, Elaine.
How are you feeling today, Marion?
Yeah. Well,
Marion, is there anything wrong?
no. Nothing.
Come on, Marion, we are here to help you. Please speak up.
I'm okay, nurse. Thank you for asking.
I can see that you appear lonely and depressed. May I know the reason, please?
I am scared, nurse. I'm scared of my condition.
Hey, Marion. Calm down. Okay. Don't be scared. We all are here to care for you. We are here to make you better and healthy. Can you follow me?
Yes. I know, but
Marion, listen to me, okay? I can help you out of the situation. But I can do it only if you cooperate with me.
yay. Yes, I will.
That's great. Now, Marion, can you please answer a few of the questions?
Okay. I'll answer you.
May I know the reason for your fear, please?
I fear about my health conditions. Doing dialysis 3 times a week and also waiting for the kidney transplantation scares me a lot.
As your kidneys are not working sufficiently, dialysis is the only option left. Dialysis is a treatment that filters and purifies the blood using a machine. This helps to keep your fluids and electrolytes in balance when the kidneys can't do their job. Without dialysis, your condition could be much more severe.
I understand.
You will be free from doing dialysis once you get the donor for kidney transplantation.
But nurse, it's becoming hopeless. I feel that a donor will never be found in time.
Do not go hopeless. Always be optimistic. I can understand your situation, but always hope for the best. Your relatives as well as the hospital are trying their best to find a perfect donor for you. You should understand that a transplantation is not an easy procedure. It is necessary to wait until a perfect matching donor is found. Don't worry, you are first in our priority list for transplantation.
All right, I can understand what you are saying. However, I just want to let you know a personal decision of mine.
Sure, you may proceed.
Thank you. During these days of hospitalization, I found that you people are saving lives of many who are near to death with the resuscitation procedure. But, if something happens to me before the transplant, kindly please don't initiate any life-saving procedure to me.
I acknowledge your concern. However, as I said before, be positive. Nothing wrong will happen to you.
I know that you people are doing your best. Please accept my request and my last wish.
I realize what exactly you are going through right now. But, I'm not the authorized person to take a last decision regarding this. So, kindly cooperate with me. Nevertheless, I can schedule a counseling support for you in order to make a decision.
Do I need to explain all these things to a counselor again?
I am really sorry to say that it is our hospital protocol.
All right, no worries. I don't want to put you in trouble. I am ready for a counseling.
Okay, even after the session, if you have the same decision. Kindly put your request in writing, and please note, your family present is important when you write it. Our hospital truly respects your decision.
This is really frustrating. Why I need to put it in writing?
Yes, your question is reasonable, and I am glad to explain it to you. The written request will be considered as a consent, not for doing resuscitation, and this will be recorded as a legal document. This is one of our hospital policies.
All right, I am okay with that.
Thank you for listening. Still be confident. Your transplantation will happen at the right time.
Thank you for your assurance.
Great. Anyway, if you have more concerns or need anything, kindly press the call button on your right side.
Okay, that's great. Thank you.
You are welcome, and I wish you a speedy recovery.
Thank you, nurse. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.